Hello, I am Dr. James Downing, one of the physicians here at First State Spine. Allow me to review my background, education, and training. I'm a native of Wilmington, Delaware. I completed my undergraduate degree with a Bachelor of Science in Molecular Biology from Haverford College. I then attended Tulane University School of Medicine and also completed my residency and fellowship at Tulane University Medical Center and the Ochsner Foundation Hospital. I am board certified through the American Board of Medical Specialties in anesthesiology, as well as subspecialty certified in pain management. After my residency, I served on active duty in the U.S. Army Medical Corps, rising to the rank of major. Following my Army service, I began my practice at the Ochsner Clinic of New Orleans, a tertiary care teaching hospital, and served as the anesthesia clinical director. In 2000, I returned to Delaware and joined the anesthesiology and pain management group at Christiana Care, and in 2003 formed my present practice with Dr. Witherow. Our practice is devoted exclusively to interventional care and treatment of the spine. I additionally serve as medical director at Spine Care Delaware, and I am a charter member of the State of Delaware Workers' Compensation Oversight Panel. This panel is charged with developing and monitoring guidelines for the care and medical treatment of injured workers in Delaware. My role at First State Spine encompasses the care and treatment of patients with spine-related problems. Many patients initially seek treatment with their primary care providers when experiencing neck or low back pain, sometimes with radiation to the upper or lower extremities. Frequently, these conditions are self-limited and can improve with the use of anti-inflammatory medications such as Motrin or Aleve. Some patients may also need additional treatment with a physical therapist or a chiropractor. However, some patients do not respond to appropriate conservative measures, and their primary care provider may refer them to me for an evaluation of interventional or injection procedures. Patients may also be referred to me from a spine surgery specialist when non-surgical treatment is indicated or for diagnostic treatment to assist in surgical planning. When I evaluate a patient in the office, I complete a comprehensive review of your history, physical examination, and any additional diagnostic data such as X-rays, MRIs, or CT scans. Together with you, this information allows us to develop an individual treatment plan to best address your symptoms. Our treatment plan will target the pain associated with degenerative, traumatic, or arthritic processes involving the intervertebral discs and the joints of the spine. These options may include fluoroscopically or X-ray guided injections, typically involving steroids, focused on your particular area of pain or disease. Over the past 2 years, we have researched and developed a protocol for offering our patients the option of regenerative medicine treatments. These treatments can provide an alternative to steroid injection or major spine surgery. This is a relatively new option for patients with spine pathology, but the research regarding regenerative medicine is ongoing. In coordination with Dr. Brian Scheipel, the Regenerative Medicine Director here at First State Spine, we have developed treatment pathways for patients suffering from pathology of the spine's intervertebral discs and joints. These treatments include the use of your own blood, which is concentrated into platelet-rich plasma, and the use of your own concentrated bone marrow aspirate. If your symptoms do not respond to conservative measures or typical interventional techniques, a regenerative medicine procedure may be an option for pain originating from a disc, ligament, or associated facet joint. The procedure is performed at our Medicare-approved and certified ambulatory surgery center, which provides the highest standards in safety and sterility with qualified and experienced staff members. Upon arrival at the center, you will have your blood drawn by a registered nurse who is skilled at venipuncture and trained in protocols for regenerative medicine. Your blood is then transported for processing to the on-site laboratory to create platelet-rich plasma, commonly referred to as PRP. After your blood draw, you will meet a certified nurse anesthetist to discuss your pain management needs during the procedure. The nurse anesthetist will be with you throughout the entire procedure. Patients generally receive intravenous sedation and are not under general anesthetic. Rather, they are comfortable and sedated, frequently with little recall of the procedure. In addition, a local anesthetic is used to numb up the skin around the area where the procedure is performed. The procedure is performed in a sterile OR room using fluoroscopy or X-ray guided techniques. You will be positioned on the table on your stomach with pillows and blankets to keep you comfortable. The procedure area is then prepped under sterile conditions to decrease the chance of infection. If a bone marrow aspirate is indicated, a special needle is utilized to aspirate the required amount from your pelvis. We utilize a technique which has been shown to provide the highest concentration of cells. Your bone marrow aspirate is then processed in our lab under sterile conditions using FDA-approved concentrating materials to create the concentrated bone marrow for reinjection. Under X-ray guidance, attention is then turned to the affected disc or discs for treatment. A thin needle is placed into the target intervertebral disc. Based on the treatment protocols and your pathology, concentrated bone marrow and biologics are injected into the center of the disc. Most patients will additionally receive an injection of the platelet-rich plasma into the associated facet joints that support the treated disc. Depending on your symptoms, an injection of biologic products created from your blood may also be placed around a painful or compressed nerve root. The entire procedure takes approximately 60 minutes, and most patients are discharged to home after recovering at the center for 40 to 60 minutes. You will be provided with pain medication for 2 to 3 days after the procedure to keep you comfortable. For some patients, improvement can be seen as soon as 2 weeks after the procedure. In severely degenerated discs, the improvement can take up to 3 to 6 months. Your comprehensive care is guided by our skilled and experienced team at First State Spine from start to finish. Your initial individual evaluation, treatment plan, and expected outcomes are guided by our combined experience, research, and developed protocols. Thank you.